I'm Judy Halstead with the Lincoln-Lancaster County Health Department. A couple of folks have joined us since we started our introductions. County Commissioner Roma Amundsen has arrived, so Roma, if you'll just share the hello, thank you. And one of our other Board of Health members, Dr. Alan Doster from University of Nebraska-Lincoln, is also here today. And we also have two special guests, and I'm going to ask Tracy and Anita to please stand if they will. There are guests from Washington, D.C. today. They have traveled the farthest to be with us. They are representing the National League of Cities, and they are here doing a site visit with us at the Lincoln-Lancaster County Health Department today. Lincoln is one of 7 communities that is been identified by the National League of Cities to work with us on a number of different health disparity issues, and particularly focusing on childhood obesity. And so they're here for the next couple of days, and they'll be meeting actually with many of you in this room, so hopefully you guys have had a chance to meet them. But I want to welcome them and tell them thank you for being here, and thank you for spending time with us and providing your support to us as well. With that, I just want to also thank a few of our staff. Jeanette Johnson and Elaine Severe, if you two could please stand. You and your staffs have both helped. Where are you guys? There's Jeanette and Elaine. Please stand. They and their staff have helped put all of this together. In addition, many of you know Charlotte Burke. Charlotte Burke is our division manager for health promotion and outreach, and she actually helped coordinate this whole event. Unfortunately, her husband's having a health procedure almost virtually as we speak, and so she is with him today, but sends her regards and her best. And Scott Holmes, who's our division manager for environmental health, is actually out of state at a meeting that he needed to help coordinate. And so those two leaders from our department are not here today, but certainly here with us in spirit and wanted to welcome you as well. So thanks to all of the staff who are here today. If I could just have all of the health department staff, I know we have a number of tables in back, if all of the health department staff could please rise and be recognized, because without you, we wouldn't be here today. So. We've had a busy year, as we always do with the health department. There's never a dull moment in public health. It used to be that we used to say, we were being successful in public health if you didn't know we were here. Well, we don't believe that anymore. We want you to know we're here. We want you to know that we're here to protect and promote your health and the health of our community. It's very important to us that we protect and promote the public's health. But this year has been a fun year. If you would have told me a year ago that we would be doing Ebola tracking in Nebraska, I probably wouldn't have believed you. I also probably wouldn't have believed that we would have actually seen measles in Nebraska again as well. We believed that we had eliminated measles in the United States back in the year 2000. Unfortunately, we have seen measles again. And unfortunately, I think it may be the wave of how we may be looking at our communicable disease issues again. And we'd made great inroads and we'd made great strides, and we need to firm up those efforts again to make sure that our communicable diseases and those diseases that are vaccine preventable, that we can do something about and that we can continue to help protect our community. And I have to just mention a little bit, I know that there are some folks maybe in this room who are not necessarily supporters of vaccines, but particularly for our children who are the most vulnerable, who cannot be immunized because of health issues that they have. They're medically compromised if they have the immunizations. We need the rest of the community to protect those children because it can be life-threatening for them if they actually get one of those diseases. So just remember that and help share our message. It really is important to protect our public. We had some exciting things happen. A couple of our supervisors from the Healthy Families America Project are here. Our staff are here. They received the national accreditation for Healthy Families America this year. And they were the first program in the state of Nebraska to receive that accreditation. And so special regards to that staff who worked very, very hard, and a number of those supervisors are here today. So we appreciate that. We've permitted a record number of food establishments. You'll hear our food awards. We've permitted a record number of food establishments over the last couple of years, including food handlers and food managers, and our responsible beverage server permits as well. We're currently permitting about 13,000 servers and sellers of alcohol in Lincoln. And so we really are looking forward to hoping that those efforts will help reduce. Really, 2 things were put in mind when the council adopted that. It was actually at the request of Lincoln Police Department to try to deal with some of the alcohol-related issues, but specifically to deal with the overservice and service to minors. And so we believe that through that permitting process, we're able to at least make sure the education and training is there on how to make sure that that happens. So again, working to protect the public is an important role that we have. With our animal control, of course, we still serve lots of folks in the community. We have coming upwards of 63,000 licensed pets in Lincoln, and Bob Downey is here from Capital Humane Society and some of his folks, and together with Steve Beal, we know that there's probably twice that many pets in Lincoln, and so we want to make sure that those animals are licensed, primarily because we want to make sure that they're healthy and that we're protecting humans and pets in our community in that way and preventing rabies. And for those of you who were tracking last year, we still don't allow wolf dogs in Lincoln. And we made a record 34,000 automated emails came into my email. So thank you to City Information Services who actually helped with that too. But we still don't allow wolf dogs in Lincoln, and we'll keep moving in that direction. And of a positive note, thanks to our AIR team, Scott's leadership and Chris Schroeder's leadership, there has been continued dialogue with Kansas. Many of you might remember this time last year we were dealing with Flint Hills and the burning in Kansas. It is an economically huge issue for Kansas to look at that practice, but our staff met with Kansas and Nebraska Department of Environmental Quality. I can't tell you that we won't have the effects, because we probably will continue to have some effects, but because of their relationship building, we are actually getting notified, and Chris and his staff are getting notified daily about where we are on Flint Hills. And so we are at least hopefully able to be a little bit more proactive in getting that word out to let folks know. But depending on how it may be this weekend, right, Chris? We'll have to see. But those are just a few of the things that we've been working on, and we'll continue to work on. And there are many staff here, and I may not have mentioned your specific program, but certainly I recognize and applaud all the work of all the staff of the health department to try and protect and promote the public's health. And with that, I'd like to move on and have our board chair come up. Dr. Heidi Stark is a pediatric dentist here in Lincoln, and she has served on our board for a number of years. And she's going to tell a little bit of a story about how she became involved with the health department, and then I'll be back up to introduce David. So thank you, Heidi.
Okay, it's my pleasure to be here representing our Lincoln-Lancaster Board of Health at our annual awards presentation and luncheon. I am honored to help recognize a few of the public health rock stars in our community. My affiliation with the health department began actually in about 1998 when I was a junior in dental school at the university here in Lincoln at the College of Dentistry. I had the good pleasure and fortune to do a rotation at the health department under the leadership of Gwendy McGinnis and Charlotte, and ended up on the mobile health clinic doing oral health screenings for children in the most impoverished areas of Lincoln. My classmate and I, Chris Brickestrand, we also got the opportunity with Charlotte's help to do some door-to-door screenings. And my classmate, believe it or not, got a gun pulled on him. Do you remember that, Gwendy? So this was a very eye-opening experience for me. The reason that I came to the health department to do my rotation is that I had been going on dental mission trips to Honduras. And as you might expect, I had seen a lot of very severe cases of decay, infected mouths, and just really horrible situations. So I certainly didn't expect to see that type of decay here in Lincoln, but actually that was what I found here in Lincoln as well, right here in Lincoln, Nebraska. So those experiences contributed to my resolve to become a pediatric dentist and serve underprivileged children here in the United States. The reason I bring this up is I want to emphasize the fact that protecting our public's health is a team effort, a very mega team effort. So as I was sitting here, going back through the years and looking at all the tables, I'm sure that I will leave some people out here. But first of all, I'd like to thank Judy and all of the staff at the health department for being just an outstanding group of people. I've been fortunate enough to know many of them for all of these years, and I want to tell you that they are amazing, and I think that we take that for granted. But I'm also preaching to the choir here, so I have a lot of mentors and people in the room, and there's organizations here, and just off the top of my head, and I'm sorry if I forget some of you, but for example, there's Clinic with the Heart here. There is the Lancaster County Medical Society. There's Lincoln Medical Education Partnership. There's Community Action Program people here. There is the People's Health Center. the mayor's office, the county, the Humane Society, Teach a Kid to Fish. So anyway, we all contribute to improving the lives of others. And so for that, I really want to thank you and welcome you to our annual Board of Health meeting.
Now I'm happy to introduce a colleague of mine, David Cary, from our planning department. When we hear the term built environment, everybody's not necessarily sure what that connection might be to health. And my takeaway from today's event is that hopefully all of you will be able to leave today, after having listened to David, to understand how we work very, very closely together. It's important to make sure that our environment in our community is one that promotes health, and David's going to talk a little bit about that. But to get to the specifics, David is long-range planning manager with the Lincoln-Lancaster County Planning Department. He is actually serving now as our interim manager. Most of you know that we unexpectedly lost Marvin Kraut, who had been our planning director. And it was, I think, a shock to everybody, not the least of which was David and the staff at the planning department. And so I encourage you all to remember Marvin. He was a great mentor for a lot of us, but his spirit, I know, is with us as well. And so we're very honored that David has agreed to fill in that capacity in an interim role. David actually has 21 years of experience in the planning field, having worked multiple years in the Chicago area, 5 years for the city of Omaha, 12 years for Lincoln and Lancaster County. His expertise includes transportation planning, land use planning, and long-range planning. He earned his master's in regional planning from the University of Massachusetts at Amherst, and has a bachelor's from the University of Notre Dame. Go Irish. When he's not at work keeping the planning department running smoothly, David also enjoys spending time with his wife and his 2 children, and exercises quite a bit on Lincoln's Great Trails Network. And so with that, I would like to ask you to join me in welcoming David to come up and talk to us today.
Well, thank you very much for having me here today. It's always a privilege to be able to come talk to anyone, but especially in a public setting like this, about the work that is being done here in Lincoln and Lancaster County, especially when it's your own work, as well as the coordinated work with the health department that the planning department does with them. It's an honor to be here. I want to thank you, Judy, specifically to give me this opportunity. It's very exciting. I just want to share with you kind of my takeaway from the basic premise of the presentation that I'm about to give. When you look at the past 10 years or so as kind of the window that I'm looking at here, with work that I've had directly with the health department, that the planning department has had with the health department, the reality is that we do a lot of good work here in Lincoln and Lancaster County, and it's really not meant to toot our own horn, but the reality is that here in Lincoln and Lancaster County, the planning department, in coordination with the health department and vice versa, we do a very nice job of acknowledging the fact that the work that the health department does from the planning perspective is very important, and the health department staff acknowledges what we are doing in the planning department is very important, and dealing with the built environment and how that affects how people live. It's somewhat of a basic premise, but until you stop to think about it, how you live is really predicated a lot on where you live and what is in your community. For example, if you do not have sidewalks, you may not be as motivated to go out and take a walk once you get home from school or work, because simply you don't have that infrastructure available. And if you don't have that predisposition to go out and be active, that ripple effect goes down to how healthy you are and how healthy your family is and how healthy the community is, to a degree, because we know that exercise impacts our health status. So it is something that I want to try to get that across, and that what we want to try to do here in Lincoln and Lancaster County is make it an easier choice for our population to be active. And part of that puzzle to get to that point is how our physical environment is planned for and constructed, and how it is presented to the members of our community. The reality also is that we have very long-standing policies that get us closer to where we want to be with our built environment, helping people make that easy choice. And without that, I think we would be farther behind than we are today. And then the reason for a lot of our policies and then the resulting projects and development that we do have sets us up for success on that active living and healthy living spectrum when it comes to this topic. And so we have a long-standing set of policies that I'll go through some of those. We have a lot of active projects that are going through the process right now, and I'll get into some of those examples. And we are planning for the future for our physical environment to be planned and built so that that choice is made. The easier choice for being active is out there for our community into the future. So a little bit about the planning department. I just want to make sure that we have some understanding of what I do and what we do in the planning department. It's always a difficult thing to put your thumb on that because I go to many events and people ask me, what do I do? And it always ends up being, well, I help plan the streets, and that's usually an easy thing for people to figure out. And then I get all the complaints after that. But that's fine. But we do a lot more than that, and I just want to be very clear about what it is that we do, and then talk about how that integrates with the health department and the work that the health department does. Part of what we do is we do what's called long-range planning. And that gets into our comprehensive plan, looking out to, at this point in time, we look out to the year 2040. And what that does is it lets us talk about what policies and concepts we want to try to employ as we look to the future. So that 2040 plan, within it, has a lot of policies and direction. It's not law, it's not like zoning, but it gives us that direction to try to work on things. And within that, we look at things like how can we make sure that we have a walkable community? How do we provide for transit, also an active form of transportation? How does our land use get laid out? And what type of information do we have to share with people so that moving forward, what we have is a community that we want to have when we get to the year 2040. So it's very important for us to look at that and go forward with the concepts and designs in our community. Another part of what we do in the planning department is what's considered development review or short-range planning. And short-range planning is the actual projects that come in to develop our community on the level of a new subdivision or a redevelopment that happens in the existing part of the city. And that is where we get into zoning and design standards and some of the near-term application of those concepts from the long-range plan. And so combining the long-range look at things into the short-range, actually on the ground, things are happening, and what we want to be able to accomplish, those combined is how we look at things and trying to implement what's in our policies and our long-range look at things. And finally, what we also want to talk about is the development of interacting with other departments, and this is a very key aspect of what we work on. We do a lot of work, obviously, and we're talking about it today with the health department and how those long-range look at things and the short-range review of projects implement the easier choice for our built environment and the physical activity and the health of our community, but also working with Public Works on our roads projects, as well as how they are involved in how transportation is handled, especially in our community. And when we talk about is looking at sidewalks, and we look at the transit system, as well as a lot of work, more recent work in things like complete streets, and trying to incorporate all these different ideas when we proceed with projects so that we're not forgetting about different aspects of our strategies to try to make sure that we have a walkable community or a transit-friendly community or a bikeable community. So all these things go into what we do. The other part of what we want to talk about today is as we get into what some of the things that the health department is working on, and things like 54321 Go. Many of you in this room I know work on that, very familiar with it. But that is from the health department side of things, that's a very important aspect of it in dealing with the obesity rates that we have in our community and trying to get people to move more and eat healthy. And again, so from the policy side on the health department, trying to implement, trying to get people to live healthier, to try to get the information out to people, as well as to coordinate with the planning department and other departments on the physical footprint of the community to try to be able to make that easy choice to be active. So getting people out there and being active and affecting the actual health rates of our community, especially on obesity and especially on children. And so those are very, very important aspects of our interaction that we have. And I think that that's something that we want to be able to move forward with as we move into the future. What I'd like to now get into is actually probably on the fly here, it looks like, without my really good visuals, talk about some of the policies that our two departments work on. And I would first start by saying my experience here, almost 12 full years of working for the planning department here in Lincoln-Lancaster County, I'd say a solid 10 years of that has been direct interaction with the health department staff. And what we talked about back in about 2005 and 6, there was actually a joint committee of the two departments. We had 4 members of the health board and 4 members of the planning commission actually got together over about a year period and had multiple meetings talking about this topic. And one of the major topics was active living and active living by design. And so for about a decade now, we've been talking about these things. And that is very important in that we really have looked at this for a long period of time now. And it's almost like it's an ingrained type of perspective on our physical outlay of our community. It's normal for staff from health department and planning department to just simply be at meetings and talk about things. And I feel very good about that when we have those meetings, because it's something that is not necessarily present in all different communities and different counties and different health departments and planning departments. So it is something that I'm very proud of, and I know Judy is as well. It becomes like a normal conversation to say, how can we affect the physical footprint of our community, and how does that impact the choice to be healthy in our community? And this is getting into things like the built environment. We have some definitions here that I want to hit on. The all-knowing Wikipedia has a definition for the built environment, but what it gets down to the basics of, without the built environment, you really don't have the opportunity to affect change in how the actions of your population are taken out. And getting more specific about a lot of research that has been done recently on the health side of the field of looking at this, that the built environment really is very important to how the physical activity happens. One very important policy that we've had for a very long time, formally on the books since the 1950s, but actually part of our tradition here in Lincoln, is the requirement to have sidewalks on both sides of our streets. If nothing else, that physical presence of a sidewalk allows for that easy choice to say, I'm going to go out and take a walk, or I'm going to go take the dog for a walk, or I'm going to have the kids go out and I'll feel safe that the kids can go out and be active in my neighborhood. And the reality is that we have an immense infrastructure advantage in our community because we have over 1,500 miles of sidewalks in Lincoln, Nebraska. And that's been built up literally over the past 100 years. That started back around 1920, became a formal requirement in the 1950s, and we've been requiring sidewalks on both sides of our streets ever since then. It's very rare that you'll see that an area of our city doesn't have any sidewalks at all. So that is a very basic policy that we've been implementing. We've also been implementing other design standards that play off of that, which is limiting the lengths of our block lengths, especially in our new developments. We try to limit our block lengths to 1,000 feet, so less than a quarter mile, so that it's easier to walk around your block in your neighborhood or get from one place to another. If we have longer block lengths, we require pedestrian easements to be put in to cut through the blocks. And what that does is, it builds that infrastructure up so that we can actually say, you can get around your neighborhood, and you don't have to walk so far out of your way just to get over to the local park or the local school. And so that is something that is extremely important for us to continue to do those things. Another policy that we have that's very important is that what we do is we've actually, it's a newer one, is a complete streets policy. And this is something that has been put on the books formally as a policy for the planning department in coordination with other city and county departments since 2013. It's called Complete Streets. I know many of you probably have heard of this before. We actually have a little bit of money on Complete Streets this year and next year. We're actually going to do some projects that were identified as priorities for the Complete Streets. We're going to see more bike route signs. We're also going to see some connections to that trail system into and out of neighborhoods where we have existing right-of-way, but we didn't have that 20 feet of sidewalk to make that connection. But what we've done over the last year and a half or so is formally put together a group of interdepartmental staff, including planning and health, obviously, but also public works, urban development, building and safety. We have these meetings on a regular basis, at least monthly, and we look at projects. We look to make sure that the projects are actually going to implement some of those concepts, again, from the comprehensive plan, the long-range look at things, but then also looking at our standards on the short-range look, a way of reviewing projects, and making sure that those projects incorporate things like pedestrian connections. Make sure that we're thinking about, well, how does the trail system incorporate with this street project to make sure that we're not missing an opportunity? Or can we try to get some funding for some other pieces and parts of our infrastructure to make sure that we're getting things accomplished as projects come forward, instead of coming back and trying to retrofit something, which is always more expensive and often doesn't happen because we can't afford to do something. So that is a very important near-term policy that we have on the books. The other piece that I'd like to talk about a little bit today is that we also have staff from different departments regularly coordinating on review of these things. And this is above and beyond just complete streets. This could be just land use in general. And so when we talk about things like where our activities happen, where if we're going to have residences or if we're going to have child care facilities and things like this is near and dear to the health department's mission. We recently have been employing things within those reviews of the projects to make sure we have some separation from our active railroads and things like that, some setbacks so that we don't have vulnerable populations living and sleeping in certain areas. And that's just another example of that interplay with different departments. I would like to move on, and this is exactly where I would like to have the pictures, but I'm not going to have them. I'd like to move on just to let you know that a lot of the projects that are happening today, things that are good examples of how we are incorporating this idea of making it the easy choice to move forward with projects and policies so that our population can say, yeah, I can go out for a walk, I can go for a bike ride, I can do all these things. And that's a great thing to have in our community. I'm very proud of that. One is we continue to develop our trail system. Our trail system is the envy of almost every mid-sized city in the United States. We have over 130 miles now of constructed trail that is very well used. We have a new higher tech trail counter on the Rock Island Trail. And we have over 1,000 users during the summer months every single day at that location. And you think about that our local streets in our subdivision areas where we live every day, actually almost all of them will have less vehicular traffic than that trail has. And there's multiple trails that have that much activity on it on a daily basis during the warm months. So what we have is a trail system that is a great way to build off of that as an asset in our community. We continue to develop that out. At least a mile a year is constructed new. And we have a lot of projects that are actually moving forward right now. We just had the Jamaica North Trail from A Street to South Street actually was just completed recently. That was a very important connection on the going in and out of downtown especially. We also have funding to do a lot of different projects. It's called the Beale Slough Trail that actually is coming off of O'Chaney and South 56th Street. And part of the South 56th Street project that's finally going to happen this year in that area, if you know about that, that is a good example of the coordination of the different departments that we talked about earlier. What we have is a trail underpass and part of the trail actually being constructed with the roadway project. And Public Works has done a very good job over the last decade or so to really step up and to acknowledge that interaction and that coordination, bringing their own money into the project, additional money, to have some of those things happen. But that Beale Slough Trail will actually go all the way down from O'Chaney and 56th down to Yankee Hill Road. And that's important because if you recall, at Yankee Hill Road and about 84th Street is going to be a new middle school. We also have existing trail over to 91st Street over by the Walmart and Sam's Club off of Highway 2. That road project on Yankee Hill Road is actually going to be constructed with that trail on one side of the road, which will then connect up to the terminus of this new project on Beale Slough, which will create a brand new big loop in our trail system. So we also have the first rectangular rapid flashing beacon crossing on 33rd Street where the Mopac Trail crosses, and it has worked well, and that's kind of have Public Works considering other places to put those types of crosswalk signals. Again, another example of all these different pieces and parts that go into the built environment that's important for us to have an active community and an easy choice to be active. Another point here, the neighborhood parks. This is part of the built environment, neighborhood parks. The Parks Department does a great job. Parks Department, by the way, is in charge of our trail system. So I want to give kudos to them for all the work that they do. They also, obviously, our neighborhood parks are a very major part of their work that they do. It is very important to have parks accessible within our neighborhoods. That is a destination for people to get to be active. And without that, we wouldn't be able to have as much activity going on, and we need to continue to get our neighborhood parks planned for and built and constructed and funded. There's that word again, funded. But we do a very good job. We have over 80% of our residents are covered by a half-mile radius of service area for our neighborhood parks. That's a pretty good rate that we have. We always can do better, but it's something to be proud of as well, along with our trails. Coordination with Lincoln Public Schools, very important. Schools are also part of that built environment. They provide some of that infrastructure that is available for playgrounds and play fields. We do have monthly coordination meetings with them. And the most important thing right now that's going on is we have the southeast area with those new schools. That is something that has created a lot of work for a lot of people. But it's also an opportunity, and it gets into some of those facilities that I talked about, the Beale Slough Trail, the South 56th Street project, and the Yankee Hill Road projects. It provides for an opportunity to build that infrastructure up for that emerging area of our city. These design standards, that's another policy area that we have on the books. We have downtown design standards, neighborhood design standards. What that does is it changes that physical feel of the area. Just some visual examples of some downtown buildings on the top there, from what it was to what it became because of those downtown design standards. It really changes that walking environment, especially in an urban setting like that when the building is up close to the sidewalk. We also have a lot of infill and redevelopment happening, which is a piece of the puzzle of trying to make our community more walkable. We have on the right side there, we have the new Valentino's up on Holdred Street that has happened. We have across the street from there is now the additional phasing of the additional housing and ground floor active retail happening. And then we have a conceptual image here of the Aspen Heights project at 18th and P Street. That'll be hundreds of new students living there in the next year and a half, I think. And that's something that just in a general sense that we have about 20% of our development and new units for residential activity happening in the existing part of the city and in downtown over the last 4 years. That's a pretty high rate compared to what we used to do. And part of that, it's important to note that because you have an existing system of sidewalks and infrastructure that allows for things to be much more active and livable in that sense. We also have projects like the N Street Bikeway. If you've been downtown in the last 2 weeks, you'll see pieces and parts of it already under construction. It's a very exciting project for those of us involved in this. And what we have is the next level of bicycle facility happening in Lincoln and Lancaster County. That'll connect from about 23rd and N Street all the way over to Arena Drive in the Haymarket area. And that'll be a protected bike facility, protected by both parking and a lot of the moving traffic, and the signals will actually be designed and built to allow for some phasing of the actual bicycle traffic. So this will be, again, that next level of infrastructure that is important. We want to keep progressing as a community. We don't want to just accept the fact, well, we got sidewalks, we should stop. No, we want to do more, and we should do more. This gets into some of the complete streets projects that we're doing. More bicycle parking is an important part of that. We want to make sure that we have adequate parking as well as well-located and quality parking. This picture of the parking is a new on-street setup near our downtown 11th Street. And StarTran is a very important piece of this puzzle as well. We have the racks on the buses now, which, if you recall, we didn't have those as early as about 5 years ago. They have ever-increasing usage of that every single year. And that makes that last mile of getting from point A to point B that much easier for people. Longer trips are more feasible on bikes now because of that. We also are studying our transit system this year. We're going into this study knowing that we have the highest rate of ridership in the last 20 years, I believe, at 2.5 million trips taken on StarTran. And so we want to make the system better and more usable for the community. On the sidewalk side of things, we talked about the policy of the sidewalks. You need money to build to maintain those sidewalks. We're in a unique position ever since the early 90s to have that the city is responsible for the maintenance and rehabilitation of sidewalks. Now we have many of those. We have the 1,500 miles of sidewalks. We have thousands of locations that are in need of repair. The very good news is that we have a ramped up commitment to provide more funding and more rehabilitation of our sidewalk system. That is very important. This past year, we had $6.5 million in total be infused into the sidewalk rehabilitation program that the Public Works Department conducts every single year. We also, moving forward, have $1 million every year, and it's an important point to be made here today, in that a lot of what we're talking about does cost money. It's not cheap and it's not easy to do. But we're getting to the point as a community to say these are important things. These are things that we need to do on a regular basis. Not only is it our responsibility, but it's a good idea for all the reasons that we're talking about today and others. So we have a commitment to have our sidewalk system that is very important for the active living piece that we're talking about, to be able to be kept in good repair. And we're really getting down and doing away with those major, the most severe sidewalk repair situations that are throughout our community is almost going to be down to zero when it's all said and done over the next 2 years. And that is a great place to be at. That's something that was being talked about for many years now. We weren't able to get the money to do that, and now we have, and that's extremely important. I think it's also important to note that the pedestrian countdown signals, many of us kind of see those every day now on our signals and crosswalks. We used to have none of these as early as about 8 years ago. And then we built out the downtown for that. With the latest influx of funding that the Public Works Department has, we will have every single signalized intersection with countdown pedestrian signals on them, which is a significant part of that infrastructure that we need to have. Related to that is that we have a renewed and new commitment to maintain our streets, our arterial streets and our neighborhood streets, our residential streets. The wheel tax that we all pay for, part of that, a good chunk of that, goes towards rehabilitation. We have more money to do that work now. And what that does is obviously it makes sure that our streets and potholes and things like that are being handled very well. Commitment to having that funding go towards that, and more funding now than ever, is very important because the streets need it. And then what happens is many of our sidewalks get redone in that sense when they're needed, when those projects go through, and our crossings and our curb ramps all get done. This is all part of the puzzle of trying to make sure that we have a walkable community. I'll wrap up fairly quickly here now. We need to keep doing what we're doing. We can't just rest on our laurels and say, well, we're walkable, we're good. We can do better, we can do more, and we need to make sure we retain the policies that we have. We want to continue to require sidewalks. We want to continue to develop our trail system. We want to do the next level of facility like the N Street Bikeway, so that we take this community to a different level of activity and making it that easy choice for active living. We have to get more funding, whether it's going for grants, whether it's trying to make sure that it's part of the city and county budgets. But the funding, the reality is that to do the projects or to do them more quickly, we need the funding. We need to keep working on that. We are going to be updating our long-range transportation plan this year and next year, as well as our comprehensive plan. And going all the way back to when I started, that is the basis of our policy development. That's where we learn and put in motion what we want to do over the long term for our community. And we want to be able to keep that fresh. And every 5 years or so, we do update these plans. So it's an opportunity for all of us in this room to be part of that. And we invite you to be part of that. We want to hear from the people that are actively involved, as well as those that maybe don't think that they should be involved, to be involved in that discussion. And then there's other things, and this gets back to kind of the relationship with the health department. There are areas of our community that don't have access to all the benefits that many of us do have on a daily basis. This is a map of some of the census tracts that fall into that area that don't have easy access and are lacking medical service access. Would also say that this area is falls into the not very good access to healthy food and food choices, with lack of groceries and things like that. This is another area that, and Judy and I have talked about this, that we haven't quite gotten to that level yet. We've thought about it, and we think this is an opportunity to talk more about that, with that relationship between our departments, that we should be talking about that. This is an important topic. Parts of our community shouldn't be lacking access to these things. And being able to get to those things or to bring those activities into their areas is something that we should be talking about. We also want to talk about how the local and state laws affect how we deal with this. Things like, we have on the books, the state has a law of the mandatory side path law for bicycles. If there's a trail or something like that along a highway, right now we're required to use that as a bicyclist. Well, that might be okay out in the rural areas, but when you get into the urban areas, when you have other facilities, or you might not necessarily want to be off the street and on a trail. You might want to be on the street. We want to open up the options to people so that they can do things a little more freely when they are out there on their bicycles. That's just an example of one. And we really just need, in general, to keep working on those obesity rates and active population. That's just so important to all of us. And what I've learned from my relationship with the health department is when you start looking at those obesity rates, and we're actually doing a reasonably good job here locally compared to national trends and statewide trends, but we really have to affect that change downward for obesity rates, because we're all going to save money on medical care over time. I mean, there's just so many reasons to do it, just simply, also just the quality of life for our community in general. So what are we really doing all this for? We're looking to the future. We'll start with that 2040 comprehensive plan and long-range look at our community. We're doing this for the next generation and the generation after that. That's what kind of gets me energized to do the work that we do, and I know that many people in the health department feel the same way. It's not about us, it's about everybody else that's coming along, and we want to make sure that what we leave them is something that's better than what we had when we grew up. So just take that with you today and then think about all the things that we can do, and then in a particular way how the built environment affects healthy living choices and active living. And so with that, I think I'll stop.
Again, David, thank you so much for everything you did. Thank you for helping to draw that link between planning for the future and planning for the health of our community. And thank you for being such a great partner with us. We appreciate it. And with that, I have some folks on the stairs waiting for me. Heidi is here, and she's going to help me do the awards. And with her also is Councilman Doug Emery and Roma Amundsen representing the city and the county. And we're going to start with the fun part, which is going to be our awards. And Heidi's going to start with our first ones. Yes, Heidi?
Yes, thank you.
We're going to take the other side.
Okay, the Community Health Service Awards are given to an individual or an organization that has demonstrated exemplary community service and or volunteerism on one or more health-related projects. Please join me on stage following the brief remarks when I introduce you by name. It is my pleasure to recognize our first Community Health Service Award recipient as the Boys and Girls Club of Lincoln and Lancaster County. Our local Boys and Girls Club began in 2007 with 3 children walking through the doors on the first day. Today, the Boys and Girls Club has a membership of more than 1,192 children and youth from 6 to 18 years. That is tremendous growth, with the majority of the membership being middle school youth from its home site location of Park Middle School. On a daily basis, the club serves about 300 kids in the after-school programs and over 500 in the summer program. The club's mission is to enable all young people, especially those who need us most, to reach their full potential as productive, caring, responsible citizens. It is dedicated to providing a safe place to learn and grow, ongoing relationships with caring adult professionals, life-enhancing programs, and character development experiences, and hope and opportunity. The staff at the Boys and Girls Club take their mission and responsibilities very seriously, and their efforts are paying off for the youth with increased academic achievement, reduction in delinquent behaviors, increased career goals, and so much more. As Nick Dean, Executive Director, says, simply having a safe place for kids to go after school is huge. Kids who don't have a place to go after school have a lot of things pulling at them that are not good, and we want to provide that safe place with caring adults and fun activities. About 73% of club members are from low-income families and qualify for free or reduced meals at Lincoln Public Schools. Many of the students eat breakfast and lunch at the school, and then, as club members, they are served a free hot dinner in the evening. For 8 weeks every summer, the kids continue to receive meals through a partnership with the health department and the summer food service program. As a designated summer food site, the staff do a wonderful job of ensuring that the 150 or so meals that are delivered are served according to all the time and sanitation requirements. The Boys and Girls Club provides many opportunities for its members, among them Power Hour to do homework, Cooking Club, Torch Club, Sports and Fitness Club, and more. Program staff of our health department partner with the Boys and Girls Club in a number of ways. In 2014, the club participated in Keep Lincoln and Lancaster County Beautiful Community Cleanup Program, where 18 volunteer youth contributed 30 hours to picking up litter around Park Middle School and adjacent roadways, in Cooper Park and in nearby vacant lots. Then they properly disposed of 140 pounds of trash, wow, and 60 pounds of recyclable material, and learned about how litter affects public health and the environment. The 2015 cleanup was done last week, but the final numbers aren't in yet, so stay tuned. For the past 3 years, teams of youth from Boys and Girls Club have worked with the Health Department's tobacco prevention staff on Operation Storefront to raise awareness among youth and adults of the impact of tobacco placement and advertising on youth tobacco use. These teams have also looked through the lens of a camera to produce photo voice, pictures that reflect tobacco use and prevention in their community. With us to accept this award are Nick Dean, Executive Director of the Boys and Girls Club. Come on up, Nick. We'll have you guys come up to the left, please, or to my left. Jessica Erstad, Vice President of the Board. Peg Schlegel, Board Member. Yes. Come on up, you guys. And Andy Larson, Operations Manager. Please join me at the podium.
I just wanted to thank all of you for being here and sharing this with us, and also thank the Health Department for investing in our kids. And I say investing because that's what it is. We've got a lot of great kids, as you can see, almost 1,200 members now. And through that, we've been able to partner with some great people. And one of these is the Health Department. It has been a phenomenal partnership for us. We can't do this on our own. And all these partnerships are crucial to what we do. And I just want to say that the programs that we have are inspiring to our kids. And not only are they inspiring, but they make the kids really think about what's going on. And so I really appreciate everything that you've done for us. And as we say at the Boys and Girls Club, and we'll tie this to the Health Department, great healthy futures start here. So thank you very much.
Our next Community Health Service Award goes to 3 agencies that together made a daring policy change that is guaranteed to have a positive health impact on their clients and staff. St. Monica's Behavioral Health Services for Women, CenterPointe, and the Bridge Behavioral Health Services, all residential treatment facilities, started in 2014 by implementing tobacco-free campus policies. Their policies prohibited tobacco of any kind, including e-cigarettes, on all properties of the agencies, including their vehicles. The policies apply to all staff, clients, contractors, and visitors. Their rationale that the whole person will be treated. It might sound easy to go tobacco-free, but it's not. It takes months of preparation before the policy is implemented. There are many steps to going tobacco-free, including determining the extent of the policy, creating signage, communicating the plan to everyone, deciding actions for noncompliance, offering tobacco cessation options for staff and clients, and many more. The 3 agencies met as a team with Health Department tobacco prevention staff for more than 6 months to hammer out the details. I'd like to share some excerpts from a letter sent to agency employees. Our agency is dedicated to providing a healthy, comfortable, and productive work environment for our employees and our clients. So we are taking a big step and will be entirely tobacco-free, effective December 1st, 2013. The next one. We are announcing the move 4 months in advance of our implementation date in order to facilitate a smooth transition. We recognize that this will be difficult for those employees and clients who currently smoke, so we are working to provide as many resources as possible to help with the change. The next one. We are excited to take this bold step, as we know it will improve the health of all employees, clients, and visitors. I'm sure there were varied responses when employees received this letter. Each of our agency representatives can tell you stories of bumps in the road with this policy, but they can also tell you many more stories that speak of success. On behalf of the Board of Health and the Lincoln-Lancaster County Health Department, I want to thank you for implementing a public health policy that is proven to improve health and even save lives. I also want to thank you for your willingness to mentor other behavioral health agencies interested in implementing similar policies and for starring in a video about your experiences. This video is being used across Nebraska and nationally. Now I'd like to ask from the Bridge Behavioral Health Services, Phil Tagler, Director, and Jody Gilfillan. From CenterPointe, Topher Hansen, the CEO, and Michelle Nelson, Clinical Director. And from St. Monica's Behavioral Health Services for Women, Mary Berry Magsamen, Executive Director, Gail Jaworski, Director of Quality Assurance, and board members Jason McCowan and Karen Ravenscraft.
You know, we started out doing this and came together by accident. We started doing it independently and then found out we were each doing it and implementing around the same time. And it really then built a bigger force and was very helpful in planning and implementation, and especially then the support of the health department, which was outstanding. They have the expertise, the knowledge, research base, and really was a major force in helping us get this done. All of us are focused way beyond the mental health and substance aspects. We're really looking at whole people and the healthcare. And in fact, people smoking cigarettes, more than half of them are either in behavioral health type services or work in behavioral health type services. So this is an effort that this industry must attack full force to help prolong the life. I know for people who have severe and persistent mental illness, they live 25 years less than we do, than the average person. And many of those reasons, most of those reasons are healthcare, diabetes, COPD, cancer, and so on. So smoking is a big deal in terms of our industry, in terms of the people we serve. And so this effort has been monumental, and I have to say I appreciate the two of these folks, Phil and Mary, because we needed their support as we went through this, and it was a struggle. It's not an easy deal to carry off with people who are so ill in residential programming, and the support we received from the two of them carrying this off was instrumental. I don't know if really we could have pulled it off without all these partnerships. So thank you.
I agree with everything Topher said. I just wanted to add one quick shout out. Renee Massey at the Health Department was really our cheerleader. And speaking in terms of our world, she was really our therapist at times when it was so difficult. Renee, now what? So I really want to thank Renee for her work and the Health Department for acknowledging the work. I just thought of one quick quote to sum up what this process has been like. And it's still going on, but I'm happy to say it's becoming a lot more normal than it did. And that is, sometimes the hardest thing to do and the best thing to do are the same thing. And I think this is one of those examples. So thank you very much.
I would echo what Mary and Topher have said. Imagine being in an agency where you're going to tell clients who historically have smoked and frankly are coming to residential treatment with all of the anxieties that involves, and telling them that not only will you have to address your substance use and mental health issues, but you no longer will be able to smoke as well. And so frankly, the points that have been made about the planning to get here are really key to the success of this. And we also have to thank our staffs. Frankly, for them, they were the harbingers of getting this focused and helping our clients understand how to transition and to do so effectively. And so a lot of work collectively has gone in. And to Topher's point, we couldn't have done this individually. As a community, to have clients think that two places no, one place maybe, wouldn't have worked at all. So the fact that we could collectively do it, and like on many projects we work on, we agree to work together because it's in the best interest of the client, are great. And the final comment has to go to the Medical Society. You know, Joan Anderson has been really a yeoman in helping us not only figure out how to put this policy in place, but also how to secure the medication that's so critical to offer to clients as they look at alternatives to smoking, both as a part of their treatment and for their lives following treatment. And so her access to all of the resources that she has and her ability to use those on our behalf has been critical to success of this. So thank you, Joan, as well. Thank you, folks.
Phil reminded me I have to say one more thing. Really, the way this happened is Michelle Nelson carried it off, who is the chief clinical officer in our organization. And she came to me, I waved the baton. I don't know how to do anything. And she is the one that pulled it off and worked her tail off and fought the battles and worked with staff and carried it off. And I know that happens in each of our shops, but I may not live through the end of the day if I didn't come back up and say, Michelle's really the one who did this. So thank you, Michelle.
That's a pretty amazing story. I doubt that there is maybe any other community in the United States that is following that same policy. Okay, our next award is the John J. Hannigan Memorial Award. This award is presented to a local physician who has exhibited leadership in the medical field and an ongoing respect for public health service. The Lancaster County Medical Society submits nominations to the Health Department for this award. This year's Hannigan Memorial Award recipient is Dr. Christian Kyle Haefele. Dr. Haefele, please join me at the podium. Dr. Haefele graduated medical school from Washburn University of Topeka in Topeka, Kansas in 1993 and completed his family practice residency from Lincoln Medical Education Partnership in 1996. After 8 years in private practice in Shenandoah, Iowa, he returned to Lincoln in 2003 to join the LMEP faculty. As a board-certified family practitioner, he has been an excellent mentor and teacher to LMEP residents for over the years. During this private practice, Dr. Haefele realized the importance of utilizing community resources for his patients and has always shared this philosophy with the residents. In 2014, he worked with community leaders to expand and formalize a mandatory community medicine rotation for the LMEP residents. LMEP now requires all residents to choose a week of community activity to be completed in their first year, with additional elective hours being available in their second and third year of residency. Residents are required to document a minimum of 24 hours from 3 of 6 main categories: environmental health, school health, community-based prevention and screening, epidemiology and communicable disease, health promotion in high-risk populations, and disaster responsiveness. Dr. Haefele's goal in creating this rotation was to help residents gain appreciation for the services available in Lincoln, as well as background for evaluation and providing needed services in their chosen communities after graduation. According to Jim Nave, LMEP business manager, our residency program has always encouraged residents to explore community services, but Dr. Haefele's efforts have created a formal process and have made it much easier for our residents to learn about community resources and opportunities and the importance they will have in their own practice. In addition to creating the community rotation, Dr. Haefele is simply an excellent family practitioner. According to a former LMEP faculty member, Dr. Bob Rauner, Kyle has a holistic approach to healthcare, from community health to preventative medicine to end-of-life issues. He is a gifted mentor to Lincoln's family medicine residents. LCMS is proud to nominate Dr. Haefele for the John J. Hannigan Award. Thank you, Dr. Haefele, for your dedication to the health of Lincoln citizens, and congratulations on receiving the John J. Hannigan Award. Joining Dr. Haefele today is his wife, Tracy.
Wow, I'm really humbled by this. A few years ago, I sat down with Joan Anderson and Judy Halstead and said, help. And really, I think that's all I did. And they really helped make this community medicine rotation come to life. And I want to thank all of you out there, the people at the health department who help our residents. They integrate them for 1 or 2 days of a brief part of the rotation and have them work side by side with them and learn that we're not practicing medicine in a vacuum. We have a lot of people out there in the community that have to provide support for us, and we need to know how to access those resources and work within the team. And that's really what we're trying to teach the young folks now. So thank you for this award, and thanks Judy and Joan in particular.
We're going to do a little switch. Dr. Haefele is too humble on that. Dr. Haefele actually worked quite a bit at trying to put a schedule together and then work and rework and work and rework those schedules. And when our staff thought we had slots available and then we needed to change slots, he was very flexible with us, and he worked very well with our residents. And we really appreciate his commitment. Most of you would probably just assume that physicians get that community practice somewhere, and they really don't in a lot of instances. And so we really especially appreciate that link with the medical community. So thank you, Dr. Haefele. We appreciate it. And thank you, Dr. Stark. We're going to obviously make a little switch here. Our next two awards are the Food Sanitation Excellence Awards. Food safety is important to each of us. We expect that the food that we eat is safe to eat. We expect that proper procedures have been used from production through distribution. We expect that the food has been prepared under sanitary conditions by people who practice good hygiene and safe food handling. Despite these expectations, 1 in 6 of us becomes ill from food each year. Our food safety program's goal is to prevent foodborne illness by assuring the food you eat is safe. In addition to training food managers and food handlers, our food team enforces the food code through conducting regular inspections of facilities. Today, the Board of Health recognizes 2 food establishments for their excellence in food sanitation. Rogelio Arias, owner of Super Taco, and his daughter Tanya, please join me. They're here today, and please join me on stage. Super Taco is owned by Rogelio and Maria Arias. It's family-owned and operated with only family members working at the restaurant. Tanya, the owner's daughter, and the food protection manager daughter, Vanessa, sister-in-law, Trinidad Archudia, hopefully I pronounced that correctly, and cousin, Jose Manuel Ventura, are all employees of the restaurant. Tanya served in the Marine Reserves and recently returned from a 6-month tour in Afghanistan. Thank you for your service, Tanya. The family moved to Lincoln from North Hollywood, California in 1996. Rogelio said they moved here because they had friends who said Lincoln was a great place to raise a family and had nice, friendly people. The family's dream was to open a restaurant, and in 2006 that dream came true. Super Taco opened at 5501 Holdridge Street. Rogelio said Super Taco means really good taco, not really big taco, correct? A great businessman. Super Taco has become a busy neighborhood restaurant with about half of its customer base coming from Lincoln's Hispanic community. A popular dish Rogelio serves to his Hispanic customers is raw oysters. Imagine that. To do this, Super Taco must follow food code requirements, maintaining the shellfish stock tags for the required 90 days, and ensure that consumer advisories are properly posted. The establishment has outstanding sanitizing, cooling, and date marketing compliance. Super Taco's history of excellent inspections, shown here as what the health department's publicly available now under our online food inspection system. And so you can see that Super Taco has done an outstanding job in all of their inspections. Rogelio said his long-term goal is to be the #1 Mexican restaurant in town. Congratulations, Rogelio and Maria Arias, for your family for receiving the Excellence in Food Sanitation Award. Please thank them and their work as being an outstanding family business here in Lincoln.
We just want to thank everybody. We never thought this would come true. Like she said, we come from Los Angeles, coming to this small town, and it was a big dream of ours to open a restaurant, and it finally came true for my parents. And we're very lucky to have a great community that supports us. And even though we've been open for 9 years, not everybody knows that we are there. So when we have new customers every day, we really appreciate that they come, and we love how everybody that loves it there spreads the word, and that's how we get new people. So thank you very much.
Thank you. Doug's making his order for tonight, right?
I just want to make sure she knew we didn't want everybody to come.
Thanks, Doug. Our second recipient of the Food Sanitation and Excellence Award is Sysco Lincoln. The Lincoln-Lancaster County Health Department is pleased to give an Excellence in Food Sanitation Award to Sysco. Sysco is Lincoln's largest food distribution center, serving nearly 1,400 customers in Lincoln and Lancaster County. Mr. Kim Brown, president of Sysco Lincoln, would you please join us on stage? 5 years ago, this operation added 245,000 square feet of warehouse space, nearly doubling the size of the distribution center that now employs approximately 500 employees on 3 shifts, 24/7. Food safety begins at the farm and ends with your fork. As a major food warehouse and distributor, Sysco is in the middle of this food safety system, providing safe, wholesome food to thousands of restaurants and grocery stores. Over the past 5 years, Lincoln-Lancaster County Health Department inspections at Sysco have identified an average of just 2 food code violations per inspection, all of which were corrected on the spot. That is pretty amazing considering the size of their establishment over the last 5 years, so congratulations on that. Almost 400 semi-trailers arrive weekly, delivering more than 400,000 cases of 14,000 diverse items that can be stocked in 7 different warehouse zones, from dry storage to fresh vegetables to frozen meats. All areas are climate controlled and are on an alarm system that is sent to phones for quick action. As a major food distributor, Sysco makes sure that when food is recalled by the manufacturer or the FDA, they can act quickly to prevent it from being distributed to or sold by our establishments. Sysco utilizes an electronic tracking system to know where every product is stored in the warehouse and where every product is distributed. Sysco has staff available 24/7 to respond immediately to recalls, stopping distribution and notifying customers that the product should not be used or should not be sold. Lastly, Sysco Lincoln is a big-time supplier of food to local nonprofit organizations that serve meals to the homeless or other indigent populations, donating thousands of pounds of food annually. Congratulations, Mr. Brown, for your efforts to provide safe food for your customers and the people of Lincoln. And with Kim today are Kelly Morrison, who's Vice President of Operations, Ken West, Director of Operations, and Kim Dorr, Vice President of Human Resources. Congratulations to Kim and to all of the staff of Sysco.
Thank you, everyone. This is a good day for the Slagles because Peg was up here earlier, and Dave Slagle, our Vice President of Sales, is joining us as well. The food supply chain is incredibly complex, and as we were enjoying the presentations, my phone went off, and we're in the midst of a recall, food recall. And it's not a serious one, it's not a food reportable recall, but that's our life. It's 24/7. It's an extraordinary process. The supply chain is really, really complex. I think that when the statistic was mentioned that 1 out of 6 of us will suffer from some sort of foodborne illness, Joyce and I kind of looked at each other like, yeah, that's the way it is. But I've been part of the Lincoln community my entire life. Today is my 35th year in the business. Wow. And what I can tell you is that things have changed dynamically and really in a good way. The United States is very, very lucky. Our supply chain is clearly the safest food supply chain in the world, bar none. But it needs to get better, and it has to get better. And that requires just constant vigil and undertaking, and it's a real process. So the recall that I was notified of, we'll identify in the next 45 minutes, we'll identify customers that have potentially received that product. We'll communicate with those customers. We'll communicate it orally and in writing. We'll document what they're doing with the product. Has it already been sold? Has it been consumed? Do they have part of that product still in their facility? And then we need to document what they're going to do with it. And then we have to, of course, report back to all the reporting agencies. And that's just the world we're in. You might not know this about Lincoln Poultry, but we're a mix of 2 different companies, Lincoln Poultry and the Pigler Company, that came together over the last several years. We've been in the market for over 100 years. And we're unique because we quietly go about our business here in Lincoln, but we're doing about $700 million in sales out of Lincoln, Nebraska. We're shipping product in the 19 states. So tonight, it's not just Lincoln and Lancaster County in the state of Nebraska, but we'll affect 5,000 food customers in 19 different states tonight. So we really have to nail it down. We have to do it really, really well. I think the thing that struck me most is that we are extraordinarily lucky as citizens of Lincoln to have the Lincoln-Lancaster County Health Department. They do an outstanding job. We work with food departments and health departments really everywhere. And what I would tell you is that there is a healthy tension with that group. And when I say it's a healthy tension, it's not a stamp, it's not a, you're gonna be able to do it this way or that way. It's really a participatory understanding that there is nothing more important than food safety. And I serve on the Food Advisory Committee. Joyce Jensen does an awesome job of managing us. And that's a great example of that healthy tension that we talk about. Not every community has that, I assure you. And there's just remarkable things happening in Lincoln. I mean, those of us that have been here our whole life, I mean, we are a small community, but we have grown dynamically. And every morning I wake up and go, holy smokers, is it changing? And it's mostly changing in a really good way, and we're lucky to be here. So thank you very much.
The recipient of our Public Health Leadership Award is well known throughout our community for her passion for the underserved. Teresa Harms is the Executive Director of Clinic with a Heart. The tagline of the clinic is a free clinic serving health, hope, and humanity. Teresa models this sentiment every day. We can use many words to describe Teresa, and all of them are positive. Let's start with her great smile. It's infectious. Just seeing Teresa smile creates smiles all around. Behind that smile is a woman who is mission-driven, a visionary, a strategic thinker and a problem solver, a master at supporting volunteers, and most importantly, a woman who is completely dedicated to helping Lincoln's poorest residents have the kind of care they need to be healthy. Teresa has been the driving force behind Clinic with a Heart for the past 8 years. The clinic was created in 2002 after a medical team from St. Mark's United Methodist Church set out on a mission trip to Mexico to provide temporary medical care to the poor. At the end of their service, the team's successes begged the question, if we can do this in Mexico, why can't we provide this health care with this hospitality, dignity, and grace in our own backyard? The answer to that question is we can, and the answer is they have. Currently, there are 11 team sponsors who staff 12 evening clinics where clients have the opportunity to receive a variety of services, including medical, dental, physical therapy, mental health assessments, hearing screenings, vision screenings, and chiropractic care. More than 3,000 clients are seen every year at the free clinic. Teresa does a masterful job of assuring that there is a smooth flow of clients and volunteers during every clinic, and she continues this smooth flow of clients out to other agencies in the community that provide the health care for the underserved. This assessment component of Clinic with the Heart and the subsequent referral of clients to medical and dental homes is key to ensuring that there's a continuity of care and positive health outcomes for the individuals being served. Teresa is no stranger to the health department. She's part of the community dental outreach team. She's a partner in the Minority Health Initiative. She works with the Crusade Against Cancer Coalition to distribute colon cancer screening kits, and is a key partner in a community-wide partnership to assure that the poor and uninsured with diabetes have access to testing supplies. She worked closely with her donors to assure that insulin was available at no cost to patients at the clinic. When this community group wanted to expand services beyond testing strips, Teresa provided the leadership, and a diabetes specialty clinic was developed. The goal of this specialty clinic is to meet with the immediate needs of uninsured adults living with diabetes, modifying their risk at the lowest cost while patients wait to establish or reestablish a medical home in the community. Clinic with the Heart knows Teresa is interested in them and in their stories. She's quoted as saying about a client, "As an urgent care clinic, we don't get to know our patients one-on-one like a medical home, but we do know that kindness we show can be a seed that grows in the hearts of our patients. Hopefully the love and respect that is shown to Ed, for example, at the Clinic with the Heart will sustain him through his struggle to establish himself in the community." Not only does Teresa bring dedication and commitment, she also brings her chief joy officer, her dog, Cookie. Teresa, we're so pleased to honor you with this Public Health Leadership Award, and thank you for all that you do.
It was so nice to see Cookie up on the PowerPoint. Relieves so much stress. I was blessed to say yes to Clinic with a Heart in 2007. And as a safety net clinic, my eyes have been open wide to how many people in our community and how many agencies in our community are holding that net. Part of the blessing of what I do is the many people I get to collaborate with who are working for a greater good. That includes my wonderful coworkers, some who are over here, 640 plus volunteers who come to the clinic, and many other agencies and people many of whom are in this room today. Thank you for the privilege of working with you. And I never in my wildest dreams thought I would quote Amy Poehler from Saturday Night Live fame, but I'm going to. So she said, as you navigate through the rest of your life, be open to collaboration. Other people and other people's ideas are often better than your own. Find a group of people who challenge and inspire you, spend a lot of time with them, and it will change your life. So thank you all for inspiring me, and thank you for this award.
Our final award is the Carroll Douglas Public Health Achievement Award. This award is presented to a health department employee that has greatly exceeded expectations in their job as a public health steward and employee. Health department staff submit nominations for this award. Anita King, please come on up to be recognized. Many of you know Anita. Anita quietly goes about doing outstanding work. She's one of those gems whose experience and knowledge are valued by all who have the opportunity to work with her. You can count on Anita. She's dependable, organized, dedicated, committed to Community Health Services' goal of connecting vulnerable people to source of care. And she is one of the most prompt people I know. If I send Anita an email or leave her a message, she's back like that. She's amazing. She works very hard with her coworkers and community partners, and she ultimately describes the best of the Carroll Douglas Public Health Achievement Award winners. Anita has been with the department for over 20 years and is known as a specialist in the area of information and referral services. She has amassed knowledge of many community agencies and available resources. She uses this information to readily assist all callers. She is skilled at assessing the needs of the individuals calling or requesting services. She's knowledgeable about our clients and their situations, their barriers, and the challenges that they face. Anita exemplifies Carroll Douglas's example of a skilled, caring, and dedicated public health nurse. For 2 decades, she has assured that vulnerable people are connected to a source of health care based on their needs and eligibility. In the Information and Referral Program, Anita works with dozens of community partners and thousands of callers each year to assure that urgent health care needs are triaged, stabilized, and resolved. She works closely with clients to prevent the next urgent episode by connecting the person to a medical home, a dental home, or with a mental health provider. Many of the people Anita serves are struggling to meet their basic needs, such as safety, adequate housing and food, relief from pain, infection, and mental health problems. Poverty and the lack of health insurance can result in going for decades without needed treatment, putting our clients at significant risk for unemployment, homelessness, social isolation, and an early death. The nursing triage that Anita provides is part of our community safety net, which is complex but becoming more integrated over time. Anita has been instrumental in partnering with Clinic with the Heart, People's Health Center, the Lancaster County Medical Society, and others to develop and implement 2 programs, a follow-up program for patients without a medical home seeking urgent care, and the Diabetes Specialty Clinic. Anita has also put tremendous effort into helping to develop outreach activities at 2 different community sites, at Clinic with the Heart and at Center for People in Need, designed to educate the uninsured about Nebraska Medicaid and the health insurance marketplace. Anita was a prime participant in these outreach efforts. Not only did she coordinate many of the efforts with other community partners, she also volunteered to fill in on weekends when there was a need. Anita represents the very best of our department in her commitment, her dependability, her partnership with the safety net providers, and in her incredible skills, which makes the system work for all of those varied individuals with complex needs. Celebrating with Anita today are her children, Maureen, Alan, and Kyle, and her mother, Mrs. Evelyn Stewart. Anita, thank you for all you do to improve the lives of the community and as a wonderful employee of the Health Department. Thank you.
Now I know why I'm tired. I didn't know I did all that stuff, but that's, I guess, what I do, and I love what I do, so I guess maybe that shows as well. So thank you very much for this award.
That concludes our awards for today, and I want to thank all of you for being part of what we do. Most of you touch us in many ways in working with our commitments to serve the poor and the uninsured, to assure the food safety and the health of our community, and you are part of our family and part of our world. You help build our safety net system because without all of us in this community, we would not have the great health and the wealth in this community that we do have. So in parting today, I want to thank all of you for being part of what we do and for being our partners in care. And thank you, and have a very healthy and safe year. And we hope to have you all back next year. Thank you.